Welcome to Global Health and Development Goals.
When we hear the phrase global health, a number of images come to our mind. We imagine, for example, the crisis of Ebola in West Africa, the movie Contagion, which depicted disastrous consequences of an accidental spread of a deadly virus across the world, overcrowding in several parts of the world, particularly in and around the cities of Asia, poor water supply and sanitation in slums in different parts of the world, natural or human-made disasters which lead to refugee camps and a shortage of food and water, the pollution of air, water, and land, and healthcare providers working in different settings across the globe. Each of these images, to some extent, accurately represent a dimension of global health. A close examination of these images tells us that the phrase global health describes a diverse field of inquiry which is expanding in many directions and focusing on several issues, all of which can have serious implications in our everyday lives. By understanding global health issues, we can learn about past, current, and emergent infectious diseases and how they can spread across the globe. Learn how the living conditions affect the health of people around the world and that of everyone else. The health consequences of natural disasters, conflicts, and humanitarian crises, and the health effects of overcrowding in urban areas or slums. Perhaps these are some of the reasons why we should all be learning about global health.
The term global health rose in popularity along with the rise of globalization. Both terms improved public awareness of vulnerabilities and shared responsibilities among people for different injustices in the world. On 2006, Director of Global Health Program at the Graduate Institute of International and Development Studies in Geneva, Switzerland states that the health pertains to various health issues concern the 8 Millennium Development Goals (MDGs). The United Nations Millennium Development Goals were created through the United Nations Millennium Declaration agreed and signed on September 2000. MDGs are 8 targets that all 191 and members on 2015 they agreed to hold all governments to account for their development. The following are the 8 MDGs. 1. Eradicate extreme poverty and hunger. 2. Achieve universal primary education. 3. Promote gender equality and empower women. 4. Reduce child mortality. 5. Improve maternal health. 6. Combat HIV or AIDS, malaria and other diseases. 7. Ensure environmental sustainability. 8. Global Partnership for Development.
Back in 2000, the UN created the Millennium Development Goals in an effort to improve life in developing regions by 2015. How far did we get? Extreme poverty rates have been cut in half, but 1 in 8 people worldwide still go hungry. Enrollment in primary education increased from 83 to 90%, yet 1 out of 10 primary school-age kids are not in the classroom. Gender equality has been met at the primary school level, but women still hold less secure jobs than men. 17,000 fewer children die each day, but 6 million are still dying before their 5th birthday. Maternal mortality fell 45%, though only half of women in developing regions get recommended prenatal care. HIV infections and malaria deaths declined by more than 40%. Still, every hour, 50 young women are infected with HIV. More than a quarter of the world's population got improved sanitation, but 2.5 billion people still don't have basic sanitation like toilets. Economic trade continues to improve, and aid money hit a record of $134.8 billion in 2013. But focus is shifting away from the poorest countries where these goals are least met. As 2015 approaches, we've achieved a lot, but there's still much to do.